Dr. Robert Gordon is a leading authority on MUA. He has performed more than 5,000 procedures and is the author of the only definitive text for the MUA procedure.
I'm Dr. Gordon. Your doctor's asked me to sit down with you for a few minutes and speak to you about a procedure that we call manipulation under anesthesia. Some people call it MUA for short. And what I want to do is kind of talk with you a little bit about MUA, and then if you have questions when I finish speaking with you, then please bring them up and we'll cover those questions. It's a procedure that has been done by osteopathic profession and orthopedic surgeons for many, many years to take joints and muscles that are very stiff and try to work with them in a little different environment than the conservative office regime. Basically, the people that respond the best to manipulation under anesthesia are patients that are just not improving in the conservative regime, that have some type of stiffness or are a little apprehensive about the type of therapy that is trying to be provided to them. When we deal with something such as helping you elongate these muscles and mobilize the joints, and you're resisting that in the office, we need to add a new tool to the toolbox in order to get you past those restrictions. That's where MUA comes in play, and that's where the anesthesia plays a huge role. If you have the comfortable knowledge that everybody that's involved in this procedure is looking out for you and making sure that this is, in fact, the right procedure, okay, then the chances of your recovery are that much better. If, in fact, you are chosen as a good candidate for manipulation under anesthesia, then you will be scheduled at the facility, and we do these in ambulatory surgical centers and we do them in hospitals. There's a whole program that we do with this, okay? It's multiple MUAs usually, and then post-care, and somewhere between 4 to 6 to 8 weeks of post-care, depending on your condition, obviously, and how you're responding, is a whole program. It's not just do the procedure and walk away. The results have been actually overall phenomenal. If we choose the right cases, okay, our statistics are showing that proper selection of the cases, we're getting somewhere between 85 and 90% recovery.
News Channel 5's Roxanne Stein shows us a procedure that's helping to relieve excruciating neck and back pain.
I got hit in the head. That's how it all started.
Excruciating pain shot through her body from herniated discs in her lower back and neck.
It jammed my head, which went down my arm, and you would just have tingling. And after a while, you're just like this, and you just could not do what a normal person would do.
She got temporary relief from pain medication, steroids, and chiropractic work. Dana Lee found relief from a procedure called manipulation under anesthesia.
This is so wonderful because we can actually put a person who literally has very limited range of motion and put them through the range of motion, the normal range of motion.
One of the reasons manipulation under anesthesia is effective is because when the patient is under anesthesia, there's no resistance to the manipulations done by the chiropractor.